Director General of WHO, Dr. Tedros, esteemed member state representatives, in particular representatives from the member states that have volunteered to undergo the pilot UHPR global peer review and participate as panelists, ADGs, directors, and colleagues representing regional and country offices, welcome and greetings to all of you. I am pleased to speak on the Universal Health Preparedness Review from the perspective of the WHO Southeast Asia region. It is universally acknowledged that the COVID-19 pandemic has revealed the shortcomings in preparedness and readiness of responding to emergencies and the response capacity at the local, national, regional, and global levels. Some key challenges have contributed to this reality. One challenge is gaps in multi-sectoral and multi-level collaboration. These collaborations are needed to truly implement whole-of-government and whole-of-society strategies for health emergency risk management. Another challenge is inadequate advocacy to place health security as one of the priority agendas of the heads of government and political leadership of countries. A third challenge is lack of transparent sharing of information on the status of emergency preparedness and dialogue as peers on the cooperation needed between countries to improve the health security status in a spirit of solidarity. Countries have been making effective use of the existing tools for monitoring and evaluation of the international health regulations' core capacities. These include the mandatory state party self-assessment annual report, SPAR, and the joint external evaluation. In fact, the country I hail from was the first to use JEE in our region. However, these have unfortunately not provided optimal opportunity to overcome the challenges at the national and global levels that I have just alluded to. With the assistance of WHO, member states also specifically monitor and review the status of capacities and resilience of their health systems using separate tools, the relevant outputs of which are not incorporated into the assessments carried out on determining the country health security status. Thus, the need to design and pilot and implement a robust process that would enable intersectoral collaboration at country level and inter-country cooperation at the regional and global levels. It was recognized by the member states. This was communicated to the WHO Director General, who has provided leadership for the elaboration of UHPR. I strongly commend the government of Thailand for piloting UHPR in our region and volunteering to participate in the global peer review that is being trialed here. I would like to note that the UHPR, as initially conceived, specifically outlined a three-level process starting at the country level, leading to regional and culminating in the global level in terms of dialogue and review. I urge both the member states and the Secretariat to reinstitute the review of the national UHPR reports at the regional level, where more efficient and relevant inter-country cooperation can be fostered using all economic and development cooperation mechanisms available. Taking this into consideration, the member states of the Southeast Asia region have endorsed the Regional Strategic Roadmap on Health Security and Health System Resilience for Emergencies 2023 to 2027. The Regional Strategic Roadmap envisages the establishment of a Regional Health Emergency Council that would be aligned with the outcomes of member states-led negotiations on the Pandemic Treaty and amendments to the IHR. Tentative provision for review of the national reports generated through UHPR has been made to enable the RHEC to facilitate sharing of lessons learned for more effective regional cooperation. I have confidence the deliberations of this meeting will be very fruitful, and I look forward to outcomes that help us to collectively strengthen national, regional, and global health security through a UHPR process that adds value without undue burden and duplication of efforts at country level. Thank you very much.